Medication administration. It's a task that happens millions of times a day in healthcare, but it is so far from being just routine. Getting it right every single time is honestly one of the most critical responsibilities a professional has. So today, we're going to break down the entire process from the why to the how to really understand how this fundamental skill saves lives.
All right, here's our game plan. We'll kick things off with the fundamental purpose, dive into the essential safety rules, then walk step by step through preparation, the actual administration, and that all-important follow-up. Let's get into it. So let's start at the very beginning. The purpose. Before we even touch a syringe or open a pill bottle, we have to understand the fundamental goal. Knowing the why is what elevates this from just a task to a truly professional therapeutic action. The goal here really comes down to one key concept: homeostasis. Think of it as the body's natural state of balance, its happy place. Every single medication we give, whether it's a pill or an IV drip, is basically a precise tool designed to help a specific part of the body get back to that state of balance. It's a targeted intervention, not just a box to check. This brings us to the absolute bedrock of safe practice. If the purpose is our why, then the 6 rights of safety are our how. And let me tell you, this isn't just some list to memorize for a test. It's a non-negotiable checklist that protects both the patient and you. 6. This is the magic number in medication safety. It represents the 6 critical checkpoints where things are most likely to go wrong. By building our whole process around these 6 principles, we create this powerful safety net that can catch the vast majority of medication errors before they happen. So here they are. Each one of these rights is a deliberate pause, a moment to verify a critical piece of the puzzle. It's like a chain of safety. You confirm the patient, the medication, the dose, the route, and the time. But listen, that chain is not complete without the final, crucial link: right documentation. Without it, the record is incomplete, and safety is totally compromised for the next person down the line. Okay, so we know our purpose and we've got our guiding principles. Now, let's get practical. Proper preparation isn't just about being neat and tidy, it's an active part of this safety process itself. This is where paying super close attention to detail prevents mistakes before they even have a chance to happen. This chart gives a really great overview of the entire process, but let's zoom in on that preparation stage. Look at the equipment section. This is ground zero. Before you even think about the patient, you have to make sure you have the right tools: gloves, the correct medication, and the proper syringe and needle for that specific dose and route. Getting this right is the very first step to a safe procedure. Now, on top of having the right tools, there's a critical safety net built right into the process: the 3 checks. This isn't just a suggestion, okay? It's a system of deliberate, repeated verification. It's designed specifically to catch any little discrepancy before it ever reaches the patient. And here we see those checks in action. Notice step 2. You gather your equipment and you perform your first check against the medication administration record, or MAR. Then, after preparing meds for only one client at a time, which is so important, you perform your second check in step 6. You're verifying the medication against the MAR again and checking that all-important expiration date. All right, our prep is complete. 2 checks are down. We are now ready to move to the patient's side. This is the phase of action and precision, where your focus is absolutely paramount. And here it is, the moment of truth. You transport the medication securely, and then, right there at the bedside, you perform that crucial 3rd and final check, verifying the client's identity. Only then, after putting on gloves and selecting the site, do you administer the medication. And of course, the procedure isn't really over until everything is safely discarded where it's supposed to go. Following the procedure is absolutely essential, but it's not enough. You also need deep, specific knowledge about the medication you're giving. This rule about potassium, it's a perfect life-or-death example. The standard procedure doesn't tell you that potassium given as a direct IV push can be fatal. That's where your clinical knowledge and critical thinking become just as important as any checklist. Okay, so the medication has been given, the equipment's been disposed of, we're done, right? Not even close. The process continues with 2 of the most important steps for patient safety and for continuity of care. This brings us to our final section: document and evaluate. This is where we close the loop. What we do here ensures the entire healthcare team is on the same page and that we can actually track the outcome of our intervention. Proper documentation is completely non-negotiable. There's a core principle in healthcare: if it wasn't documented, it wasn't done.
You have to record exactly what was given, when, and where. But you know what? It's just as critical to document what wasn't given, a refused dose, for example. This isn't just paperwork, it's the legal and clinical record that the rest of the team relies on for safe, continuous care. And it's so vital to understand the difference between documenting and evaluating. Documentation is the act of recording what you did. Pretty straightforward. Evaluation, though, is the clinical skill of observing the patient's response. Did the medication work? Are there any adverse effects? This is where your clinical judgment really comes into play. And that evaluation includes actively monitoring for complications. You're looking for everything from a simple local reaction, like some pain or swelling at the injection site, to more serious issues like a systemic reaction or an allergic hypersensitivity. The act of giving the medication is just one moment in time. The evaluation that follows is what ensures that patient's ongoing safety. And that really brings us to our final thought. When you combine the purpose, the 6 rights, and all the meticulous steps of prep, administration, and evaluation, you transform what seems like a routine task into a powerful, life-saving action. It's a profound responsibility.